Next, health care. If I saw one thing that unites Americans as I traveled this country, it was the concern of the American people about their families facing rising health care costs. If 40 million and 45 million Americans not having any health insurance, but then those who do have health insurance are finding themselves strangled by rising premiums, co-pays, deductibles, so that we are one nation with an abundance of money spent for health care, 1.6 trillion and more, and yet a quarter of that money, more than 400 billion a year, goes for not health care, but for executive salaries, advertising, marketing, the cost of paperwork, 15 to 30%. Not for health care, 400 billion a year. If you took that 400 billion a year and created a universal, single-payer, not-for-profit health care system, which the Conyers-Kucinich bill advocates, H.R. 676, we would have enough money in our system to pay for all inpatient and outpatient care, for dental health, mental health, long-term care, a prescription drug benefit, durable medical equipment. We're told we don't have money for health care. That's not true. It was mentioned earlier, we're already paying for a universal standard of care. We're just not getting it. This is about reclaiming the commons and reclaiming our health. Just as we reclaim the commons and protect our retirement security, we reclaim the commons and reclaim our health. People say, well, how can we afford it? We're already paying for it. But in addition to that, we can underwrite existing costs by an extra tax on either the top 5% income or by having those employers pay a 6.7% tax or something like that, which they're already paying more than that, those who are paying for the health care, and yet their employees aren't getting the kind of benefits that they need in order to have a healthy workforce. We're long past the time when we should be having universal single-payer health care, and all Americans know this. We're also long past the time when we have to look at some innovative ways of funding infrastructure improvements. Congressman Steve LaTourette, a Republican from Madison in Ohio, and I came together and we proposed legislation to create a federal bank of infrastructure modernization, which would set up a fund that would use monies that are not being used in the Treasury to issue zero-interest loans to the state, numbering $50 billion a year in each of 10 years to help rebuild America's infrastructure. Now, I saw the presentations about infrastructure. We are on the threshold of a new opportunity to rebuild the American economy. Just like FDR recognized. The WPA was about rebuilding America. And the Civilian Conservation Corps augmented that by putting people back to work restoring the environment. We can do the same thing again. And some of the ideas that have come out of the American Monetary Institute's conference here tell us ways that we can get additional capital. Tell us ways that we don't have to strangle this nation in debt anymore. And it's going to be my pleasure, Stephen and Elizabeth, to take this discussion to Capitol Hill, because Washington needs to understand how we've been mired in debt and are staying there with the help of this fractional reserve banking. Washington needs to understand. Washington needs to understand that questions must be raised about why did we, in effect, give up our control of this asset, this ability to be able to issue money? Why did we give it to the Federal Reserve? We need to look at that again. It's not as though this country's, should be headed for bankruptcy or our people for destitution. The money's there. We need the will there to begin to look at America in a new way and look at our potential to create material wealth in a new way.